Hi, my name is Carmen Beaumont and I am the Director of Vita Psychology. This brief video will provide you with all the information you and your loved ones need to know about postnatal depression. There's a lot of misconceptions out there regarding what causes postnatal depression, so I wanted to set the record straight. By watching this video, you will not only have a full understanding of the causes or various causes of postnatal depression and complexities, but also you will be able to identify what caused your own postnatal depression. Just a quick reminder of the difference between baby blues and postnatal depression. Around 80% of new Australian mums experience what we call the baby blues, where they become irritable, teary and anxious for no apparent reason. This usually takes place between days 3 and 10 after giving birth. These symptoms usually disappear within a few days and women go back to being their normal selves. And in this instance, no professional intervention is needed. Postnatal depression, on the other hand, is characterized by feelings of dread and depression associated with giving birth, typically from a combination of having to adjust to being a mother, being exhausted, and experiencing hormonal changes. Women can develop postnatal depression at any time during the first year after childbirth, but it usually develops within the first 4 months. As mentioned earlier, in this video, I want to set the record straight on what causes postnatal depression, as we see a lot of moms at Vita Psychology who are not only unaware of the complexities of postnatal depression, but unfortunately have inaccurate information. We know when women experiencing postnatal depression are not provided with crucial and factual information, they tend to blame themselves for it. This unfortunately results in not only not talking about their experiences, but also not seeking help both professionally and from their loved ones. These women end up not only feeling guilty for having their postnatal depression, but also feel quite ashamed. Once again, this prevents them from getting the right professional support, and the postnatal depression only gets worse. We know when women experience postnatal depression, it affects not only them, but also their bonding and interactions with their baby, as well as their relationships with their partners and other family members. In some instances, unfortunately, couples end up separating. Please don't let postnatal depression get in the way of your relationship with your loved ones. If you or someone you know can relate to this, I will let you know what you can do to get the right help at the end of this video. At Vita Psychology, we have vast experience helping women adjust to the challenges of motherhood so they can make the most of being mums. With the right help of one of our Vita psychologists, you will learn the latest research on what causes postnatal depression and be provided with information that is specific to you and your family. This will make it possible to not only stop blaming yourself, feel guilty or ashamed, but also take the right steps to address postnatal depression. By doing so, you will not only begin to enjoy motherhood and make the most of it, but you will also know how to ensure to reconnect with your partner. So, what are the causes of postnatal depression? There is a lot of research in this area, so we know there's a number of factors contributing to a woman developing postnatal depression. For the purposes of this video, I will break them up into 3 different categories. The first one is biological factors. These are things such as genetic predisposition to depression, and this refers not only to a history of postnatal depression in your own family, but also a family history of depression. Sudden changes in pregnancy hormones following delivery, any nutritional deficiencies, sleep deprivation, history of premenstrual tension. The second category is what we call psychological factors. And this refers to difficulties with fertility and use of IVF for conception. Having a difficult or traumatic birth, so things such as unexpected interventions and needing an emergency cesarean, for instance. Having a traumatic or abusive childhood, particularly sexual abuse. Having pregnancy difficulties, as well as unrealistic expectations of motherhood and of yourself. Certain personality types are also prone to developing postnatal depression. For instance, being a perfectionist or needing to have control. Having limited social or emotional skills. For example, lack of assertion, having a problematic or unresolved relationship issues with your own mother. Past unresolved issues of grief and loss, such as previous miscarriage, stillbirth, or death of a loved one. And the third category is social factors, and this refers to things such as lacking family and community support, having a difficult relationship with your own partner, for instance, your partner being removed emotionally, or having to work long hours or traveling often. Having an intrusive or difficult family, this also includes the in-laws. Being socially isolated, experiencing financial hardship, lacking close relationships, particularly friends with children, being of a younger or older age, loss of employment, whether it is yours or your partner's, family and society expectations about your role as a mother. As a result of these contributing factors, postnatal depression is not only complex, but it also means each woman's experience of postnatal depression is unique, depending on the combination of these factors. So, postnatal depression is not something that just happens overnight, even if at times it may feel like this. It is something influenced often by things out of your control. Postnatal depression is not something you can just ignore and it will go away. We know once again, if untreated, it negatively impacts not only you, but also your baby and your loved ones. If you think you or a loved one can relate to this and would like a copy of our Understanding Postnatal Depression fact sheet emailed to you, call 93283636. Alternatively, you can call that number to make an appointment to see one of our psychologists. By seeking our help, you will learn more about what caused your postnatal depression and how you can begin to beat it. Feeling like your old self, enjoying motherhood and your relationship don't have to be compromised by having a baby. Take action today.